Hello, I'm Dr. Sujesh Shanshanwal. I'm a consultant dermatologist and medical director at Skinama Clinic. Now, in one of my earlier videos, I have spoken about why acne happens and what are the different types of acne eruptions that a patient can have. So I will mention the link in the description below in case if you haven't seen it. Now, in this video about the patients who have acne, I want to speak about what precautions should be taken and what changes or care they need to take in their day-to-day routine to ensure that the acne is controlled and to prevent a flare. Now, every patient, especially those with acne, should wash their face at least 2 times a day. Now, your skin continuously secretes oil, and we need to ensure that there is a clean surface. So, you should wash your face twice a day. If somebody has a very oily face, they can even go for a salicylic acid containing face wash for better oil control. And if you have traveled outside or if there has been dust exposure, you can use your face wash multiple times a day also to ensure that you keep your skin surface clean. But now cleaning your face doesn't mean that you scrub it hard. Now when you scrub aggressively using a loofah or some hard material, you also damage the skin layers, which damages the skin barrier and can lead to trapping of the gland ducts and can lead to easier entry of infection. So you need to avoid scrubbing. If you want to scrub, you can use bead containing mild, gentle exfoliating face wash, but do not use rough material on your skin to scrub it hard. So face wash should be used at least twice a day, and you can use an exfoliating face wash if required, but avoid rough scrubbing. Now sunscreen. Sunscreen is something that patients should frequently and regularly use. But in patients who have acne and an oily skin, they should avoid using lotion or cream-based sunscreens. For patients with an oily skin, gel-based sunscreens are preferred so that they do not aggravate the oiliness. So you should use a gel-based sunscreen, a non-comedogenic sunscreen. Now, apart from sunscreen that you use on a regular basis, makeup is something that females commonly use. But you need to make sure that you buy the right products for your skin. So a patient with an acne-prone skin needs to go for a non-oily, non-comedogenic, and a water-based makeup to prevent the flare of acne. Also, when you're using makeup, keep it on for a limited time. So once you're done with the purpose of your makeup, clean your skin surface so that there is no residue left which can unnecessarily worsen your acne. And never ever keep your makeup on overnight. So make sure that you take good care of your skin and remove the makeup once it's done. Also, brushes that you use, they need to be kept clean, because after you use your brush and you just keep it lying there, and then it can catch an infection which can worsen your skin problems. So the brush has to be cleaned regularly. Now, how frequently does one need to clean would depend on how frequently one uses the brushes for their makeup. So make sure that you maintain good hygiene, not just for your skin, but also for the products that you use on your skin. Apart from makeup, now let's come to diet. That is something that patients are often curious about, what changes they need to make in their diet to decrease the chance of acne eruptions. Now, dairy products, milk and milk products have a role to play in aggravating acne, which means milk, yogurt, cheese, chocolate, paneer, ice cream, tea, coffee. These are the things that you need to cut down on your diet. Apart from that, fast food and oily food can also worsen acne. So these are the things that you need to cut down. You did not eliminate it completely, but cut down your consumption to prevent an aggravating chance of acne. Apart from this, high glycemic foods like even mango as a fruit which has a high glycemic index can also worsen acne. So these are certain precautions that you need to take when it comes to diet to prevent a flare of acne. Also, you need to keep a good water intake. Having a good water intake ensures a good cleansing of your system and preventing accumulation of toxins. Now you also would be going to gym. So when you go to the gym, there are certain precautions that you need to take. You should always keep a clean towel that you need to use. When you use a towel in the gymnasium and you have to keep it on the instruments, make sure that a fixed clean side is used to contact your skin surface and the other side is used to get in touch with the instruments. Otherwise, if you touch one side of the instrument with the same side you clean your surface, you'd be taking the organisms and depositing it onto your skin, which would not be healthy. Also, obviously, never share your towels, keep a clean towel, and once you're done with your workout, clean your face. Because of the sweating, you need to make sure that after that you just rinse your face so that you just clean the surface once. Apart from diet, maintaining hydration, gym care, now let's come to patients what they do at home to handle their acne. Comedone removal is something that patients sometimes tend to try doing it themselves or they go to a salon for. So comedone removal basically means a cleanup where the clogged pores, the blackheads or the whiteheads are removed to remove the trapped secretions. The process of doing this has to be right because the collections which are trapped inside, if you do not remove it or clean it properly, the secretions can get released inside the skin, which can cause an inflammation and even worsen your acne. So doing it properly is very, very important. Coming to a thing that patients often resort to, which is popping of their pimples. Now, how I was explaining earlier that if the comedones, the blackheads and whiteheads are not properly drained or cleaned, the secretions are released inside. Similarly, when you're popping your pimple, that increased pressure leads to rupture of the gland wall inside, which can cause secretion of those harmful chemicals and infection inside the skin, which can worsen the inflammation. So that is something you need to avoid. Some other thing that I have often seen patients tell me about is that they have tried either applying toothpaste or baking soda or lemon on their acne because they heard somewhere or read somewhere that it helps to control the active acne. Now, these chemicals can have a harmful effect on the skin, and because if you're not using it correctly, they can further worsen your acne by damaging your skin, increasing the inflammation, which can lead to worsening of the pimples as well as the marks that they would leave later. So you should avoid experimenting with your skin and using things incorrectly, which can further worsen your skin, worsen your acne, and cause more damage. So be careful about these things. Follow these certain common precautions and daily routine changes that I have explained and advised, and it will help to prevent a flare of acne and to keep your acne under better control. I hope this video was useful. Thank you.